Hello, my name is Dr. Reed Tuckson, and I am pleased to be your moderator for this extremely important and very timely conversation. I'm lucky enough to be a co-founder of the Black Coalition Against COVID, which has really been an important opportunity for all of us to push new knowledge, factual, evidence-based information to our community to help people make personally appropriate evidence and fact-based choices. We want to welcome you tonight to Adults Need Vaccines Too. And that means that tonight you will learn that vaccines are not just for children, and we will explore why, when, and what vaccines you need to take to be healthy and safe. This conversation is sponsored by BIO, the world's largest biotech trade association, the field where breakthroughs begin. Please also know that we are very interested in your questions. And so please make sure that if you have a question, place it in the chat so that I can present it to our panel of experts. And what a panel we have for you. Let me start with Dr. Manisha Patel, a captain in the United States Public Health Service and the Chief Medical Officer for the National Center for Immunizations and Respiratory Diseases, where she directs and oversees a broad and complex range of public health programs that are operated both in the United States and around the world. She's a double boarded certified pediatrician and also certified in pediatric infectious diseases. Also with us is Dr. Jihan El-Bayoumi. We call her Dr. Gigi. She's the founder and executive director of the Washington, D.C. based Rodham Institute, where she is also an internal medicine specialist and an adjunct professor at the Georgetown University and a member of the Black Coalition Against COVID. Dr. Joycelyn Myers, a board-certified endocrinologist and a national speaker and consultant who has a special expertise in the issues of our hormonal system, as well as a special expertise in diabetes management. We also want to welcome Dr. Candace Robinson, board-certified pediatrician with 15 years of experience in pediatrics, vaccines, and public health, all of which help her in her role as the Director of Scientific Affairs and Public Health Vaccines for U.S. Medical Affairs at the company GSK. Carita Ambrose, PhD, is the Senior Director for Medical Affairs at CSL Seqirus. Her career spans 20 years in the vaccine industry. With a doctorate in microbiology, she's had special training and expertise in infectious diseases and launched several vaccines that are currently used in the market today for diseases such as influenza and meningitis. And finally, we are very glad that Charlie John, PhD, is the Director of Healthcare Strategy for the Walgreen Company. His work primarily involves engaging with public officials and industry and community leaders around healthcare policy in efforts to improve the administration and outcomes of our healthcare system. Well, to get our conversation started, let me turn to you, Dr. Patel, and help me to understand, help our audience to learn, what are some common vaccines that are recommended for adults at this point in the year?
Well, first, I just want to thank you for having this conversation. It is such an important conversation to think about with vaccines for adults. So really appreciate you including me today with this amazing panel. So let me split it up into two parts. One is, what do all adults need? And the second is, like you mentioned, is what do we need to worry about now? So all adults need 3 vaccines. One is the influenza vaccine or flu vaccine that's recommended for everyone 6 months of age and older. And the best time to get that vaccine is actually now. September and October are the prime times to get that vaccine for most people. And I want to just mention is that there are a couple of different formulations of the flu vaccine, and it's especially important for adults 65 and older that they get that high dose flu vaccine because they're the ones that are at highest risk for severe illness and hospitalization. Second vaccine, Tdap, which protects against pertussis or whooping cough. It's a one-shot deal if you've not gotten that one before. And then the third vaccine is COVID-19 vaccines, and that's recommended for everyone 6 months of age and older. Yesterday, this was licensed by and authorized by the FDA, and even just today, it's been by the Advisory Committee on Immunization Practices. Now, I just want to make one point, is that we have used this vaccine for the past several years, and over almost 700 million doses of this vaccine has been administered in the US. That's almost twice the size of the US population. And it has served to prevent almost 18 million hospitalizations and saved 3 million lives. And so this is just really an important time to think about getting your COVID-19 vaccines, your flu vaccines, and also, most importantly, a new tool in the toolkit, which is called the RSV or respiratory syncytial virus vaccine, which is recommended for people 60 and older. And let me just give you one last point about the RSV vaccine. What I want to see is that the older adults, 75 and older, those folks living in nursing homes or long-term care facilities, the medically fragile patients, those with underlying medical conditions, those are the folks that we want to make sure get their flu vaccine, their RSV vaccines, and their COVID-19 vaccines.
Well, it's a very, very complete and important list. Let me just ask you really quickly, though, to also comment. I'm one of the people that have gotten their shingles vaccine. And I wonder if you might mention the importance of shingles vaccine and also the hepatitis B vaccine.
Yeah, shingles vaccine is so critical. It causes substantial morbidity in the United States, an extremely painful disease to have. Now, what's different about shingles is that it's older adults that get that disease. And so we recommend two doses for everyone that's 50 and older. Kids don't get shingles as much because they're generally healthy. They get the other virus, varicella. But luckily, we have varicella vaccines to protect children in the United States against that same virus. And hepatitis B vaccine is recommended for certain people with underlying medical conditions. Those recommendations differ depending on what your situation is. And certainly, we want to make sure healthcare providers are vaccinated against hepatitis B.
Very good. Dr. Myers, let me turn to you. Why are these adult vaccines important? I mean, we live our lives every day. We seem to be fine. Why do I need to make sure I'm taking one of these?
Well, first, thank you very much for having me. But I do think it's important that adults get vaccinated. I think that we frequently think of vaccinations as something that happens for children, but for adults, it's important not only for us to keep ourselves healthy, but also to keep those around us healthy. I can tell you that I had COVID vaccine and a booster and still ended up getting it at an outdoor function. And my biggest concern was, did I get anyone else sick? And despite the fact that I was in close contact with several other people, including people who were older and were immunocompromised, my own personal illness was actually very short. I felt bad for about a day and a half. But more importantly for me, I didn't make anyone else sick. So that's one of the big issues with people who are vaccinated, not just against COVID, but also for flu, that your own personal illness may be less intense and definitely less dangerous, less risk of hospitalization, and definitely less risk of death. But you also may be preventing someone else from getting sick. So when you're thinking about getting vaccinated, you want to be vaccinated not just for yourself, but for those around you.
I think this is such an incredibly important point. We know, and you've just really emphasized this, Dr. Myers, the sense that when it comes to these transmissible diseases, we're all in this together. And what I do can affect someone else. And the nightmare that any ethical, moral human being could ever have would be to say that I gave someone else a disease because I was not willing to do what was necessary. So I'm so glad that you have made that point so eloquently. Dr. Gigi, why in your mind is it so important? And I would just ask you to maybe even start with, I know that you have taken care of seniors who've had shingles. And it's something that it's just terribly painful, isn't it?
It is very painful. I actually have somebody that lost their eyesight because of shingles, and another person that for the last 5 years of his life was just plagued by severe, severe pain. It feels like electric shocks. So shingles, for anybody who's experienced it, thankfully not everybody gets those, but we don't know who is going to get the bad complications, right? But some people really, really suffer. I want to just bring up, I thought it was cute, by the way, that Dr. Patel said for those older adults 50 and over. I must be really old. Let's not forget the pneumonia vaccines. There are two of them, Prevnar 13 with 13 strains, with vaccinations against 13 strains, and then another pneumonia vaccine that protects you against 23 strains. You know, talking about what Dr. Myers said, today I was in clinic all day, and I had a 21-year-old young lady with lupus. And so we were discussing the importance of her getting vaccinated, but also her family. Her dad, who was there with her, and the mom said, you know what, I don't want to get any more COVID vaccines. I'm tired. And a lot of discussions today in clinic were that people are a little bit weary of all these vaccines. Why do we have to get all these vaccines? And as you said, Dr. Tuckson, what I do affects you and vice versa. And, you know, we don't know who we're sitting next to. It may be that young lady who's 21, who looks okay, but she's on these very powerful medications that suppress her immune system, could get a very bad complication from COVID or influenza or RSV. So these are very important. I wanted to bring up one more point, and that's about the tetanus, the Tdap, which has pertussis. For anybody that has a new baby in their household, parents will suggest and really insist that any adults coming into contact with that baby get a vaccine against pertussis. Pertussis is the old whooping cough, and we're lucky that we have a vaccine against it, because you know what? I've been seeing a lot of viruses that we don't have vaccines for. So let's try to protect ourselves with the vaccines that are available.
Great. You know, one of the challenges, panel, that we have in America is that because we have in the past done a pretty good job, especially with our children, in vaccinating them, that these diseases that used to kill so many people are now not harming us. And so we tend to trivialize preventable diseases that can be stopped and prevented because of just simply using vaccines. And so we've got to remind people the reason why we're not experiencing, as we did in the past, measles and polio and all these things, is because, in fact, the vaccinations were effective. Now we're starting to relax our vigil, and now some of these diseases are coming back. And so this is why this conversation is so important. Dr. Patel, help us to understand some of the key differences between vaccines for children and for adults. Are they just the same?
It's a great question. We get this all the time in my clinic as well. And I like to think about it in sort of three different buckets. One is the disease itself. How does that differ? Second is the actual vaccine formulation and the amount of the vaccine. And then third is the recommendation. And you're right, they do differ. And so when we talk about disease, let's take RSV, for example. RSV.
Respiratory syncytial virus.
That's right. Thank you. Respiratory syncytial virus. That particular disease causes wheezing in little babies and instead causes pneumonia in older adults. So we don't see as much of our older adults wheezing against something like when they have an infection with RSV. And so sometimes the disease presentation does differ. Now, I just want to mention this because this actually came up in my clinic the other day, where I had a parent come in and say, what is this RSV? Is my kid going to get it? And the reality is most people do have RSV infections by the time they're 2 years old. Who we're really worried about is the extremes of age, the little babies and the older adults over 75 years old. So disease can be one thing that's different. Second is the vaccine formulation and the dose. For example, COVID-19 vaccines for children less than 5, the Moderna vaccine dose is actually different than what we are giving to adults. And so it's important to make sure that you understand what the actual formulation and dose that you want to give to that particular patient. And then I mentioned is the recommendations. And again, COVID-19, the recommendations came out today, is that for children less than 5 that have never been vaccinated, they might need 2 or 3 doses, depending on the vaccine type. If you're older, you just need 1. So again, it can be complicated, but it's also really important for our providers and our patients to understand.
Excellent. And let me turn to you, Dr. Myers. How do you view your role as a healthcare provider in promoting adult vaccination?
I think it's really important that people talk to their primary care providers. I don't do primary care, but I do see a lot of patients who are immunocompromised. And so for my patients in particular, it's important because of their immunocompromised status that they get vaccinated. So I make sure that I recommend them and let them know what the options are for them, what their what's recommended for them given their age and their status. Because patients who have diabetes are immunocompromised. Patients who have other autoimmune diseases, who I may see for other reasons, may also have issues, and they may need higher doses. And there may be issues with when they get their vaccinations, particularly if they're on biologic agents, and when they get those biologic agents.
So, Dr. Gigi, I think what Dr. Myers is opening up here is that, first of all, it is simple to get vaccinated, and that is not a big hassle. It happens very, very simply and very easily as a normal part of the healthcare experience. But what we are learning here is that, first of all, that there are quite a significant number of vaccines that you need to have, and how does a person keep track of it? But then also it is, what is your own personal risk, your own personal health history, and how that plays into it. How do you sort of pull all that together, Dr. Gigi?
Well, it's important that we as physicians, clinicians, and let's not forget nurses, PAs, nurse practitioners, pharmacists, as well as our patients and their families work together. It is a lot to keep track of. You are absolutely right. So if the patient as well as their healthcare team can keep track together, that would be great. If you want to keep track as an individual, go to the CDC website or others so that you can see what it is that you need. I would say be opportunistic. If you have any sort of chronic medical illnesses where you're going to the doctor's office or the clinician's office all the time, sometimes what gets left behind are those healthcare maintenance, whether it's screenings for cancers or vaccinations. So people, I try to think of people in sort of low, intermediate, and high risk groups, right? Low risk are people who are otherwise healthy, who are not smokers, who don't drink alcohol or not much alcohol, who are active, who are exercising, and who sleep enough, because lack of sleep affects your immunity. And then I think about high risk groups. High risk groups are people who are on chemo or on medications for things like lupus, people who've got diabetes. But let's not forget people with emphysema and underlying lung disease, or sickle cell. So it's not just the age. Of course, as you get older, then what happens is that your ability to fight off infections gets lower. And then you couple that with other illnesses, and then you're at very high risk, not only for getting sick, but actually dying and or ending up in the hospital. So I think it's important to know what your individual risk is and to keep track, and don't be shy. Remember too, the person putting you in the room can also be a good source of information. It's a healthcare team. Doctors are not the only authorities. And I say this as a doctor.
Well, I think that you've made a couple of very important points that I think we really do want to emphasize. Number one is, if you feel that that you really want to make sure, and we do want you to make sure that what are the vaccines that you should be taking at this point in your life as an adult, go to the CDC website. I want you to know that that's where all of us go. That's where health professionals go. I know the CDC is much in the news these days, but be assured, the people that are working in the CDC, these are the top scientists in the country, and they are very, very sharp, people like Dr. Patel. So please make sure that if you have a question, do what your physician does. Go to the CDC website and see what they have. And I see the website is put up on the screen for us now. But secondly, is that we're all supposed to, as Dr. Gigi suggests, we're all supposed to go to our physician regularly, our regular every yearly health checkups. And that's the time when all of this can be gone over, and it can be made very simple and very straightforward. So please remember, keep your your regular prevention checkups every year with your health provider, and make sure then that the vaccine conversation is a big part of it. This isn't complicated. It is pretty much straightforward. But unfortunately, and let me turn to you, Dr. Robinson, we have noticed that there are barriers to Black adults getting vaccinated, that we have challenges in our community. So many of the things that we face as Black Americans are complicated by our social environment and sometimes our socioeconomic environment. Can you sort of give us a sense from your experience, some of those barriers, real or perceived, to Black adults getting vaccinated?
Sure. I think there are a number of barriers to vaccination in many communities. There can be access barriers and certainly where to get vaccinated, and also knowing what to be vaccinated for, knowing risks, making sure you understand your risks and making sure people understand what vaccines they need is also another barrier. And then also where to go. Where do I go to get information? Making sure people have those trusted messengers to go talk to their doctors, talk to their nurses, talk to their pharmacists to make sure they have that accurate information to make the vaccine decisions and to understand what vaccines they need. And then making sure that they have places to go to be vaccinated as well are also all reasons and sometimes barriers to vaccination.
That's very important. Dr. Myers, do you have a sense that there's been extra challenges in adult vaccines now because of some of the confusion, the misinformation, the absolute, some of the crazy kinds of things that were promulgated during the COVID vaccine time period that we just came out of and are now back in again? Are you seeing impact from that experience bleeding in now to routine adult vaccines?
Oh, absolutely. I think that one of the issues that happened a lot with the COVID vaccine, I got a lot of pushback, particularly from the Black and Brown community, just not trusting the government, not trusting the vaccine, not trusting, that they were, I'm not going to be a guinea pig. I'm not going to, I don't want to be first to have it. And so there was kind of that argument. And then so my argument then became, okay, 1 million people have had this vaccine. How many more need to have it before you're going to feel safe? People are, jumping the line or driving state to state. They're flying into the country to get it because it was easier to get it certain places than it was other places. There's things on the news about people flying in, from South America to Florida because they were able to get the vaccine there. I'm like, so now what's the argument? And I still got a lot of pushback. Some people really understood, as things kind of went on that it was safe to get and that, that they needed to get it. But there was definitely a pushback, I think, historically, and you can't discount, Tuskegee and all those issues. Those are real things that actually happen, and you have to understand that people are coming with that historical emotional baggage. But you have to understand that you have to kind of move past that. There also is the issue of the fact that a lot of vaccines are not tested in our communities, and that also becomes an issue where people feel like, well, maybe they weren't tested on us. Are they giving us the right stuff for us as opposed to giving what other people need? And understanding that if you're not willing to be part of the solution in terms of the vaccine trials, then that makes a big difference. So if you want the vaccines to be represented, then step up and help with that representation.
One of the things that I think many people are not aware of is that when we first started out with this COVID experience, Black Americans were dying at such frighteningly high rates until we finally got the vaccines in place. And it took us a while. It took us a year to really get people mobilized in the Black community around around that vaccine because of Tuskegee that you've mentioned and other kinds of things. Until I think a lot of people finally got the message that, wait a minute, Tuskegee was about Black men being denied the drug that would save their lives. Now, let's see, my protest against the world will be, I will deny myself the drug that will save my life. That'll show them. And I think people began to really realize how crazy that was. But, Dr. Patel, one of the things that I think goes along with that is that we have seen that when Black Americans, through their faith-based and community-based organizations, mobilized to get that vaccine, we outdid the rest of America. And as a result, Black folks in the second year of the pandemic had better life expectancies than even white America because we did such a good job of getting the Black community vaccinated. Does that give you reason, Dr. Patel, for optimism that we can do just as well with these other vaccines?
I'm so grateful that you talk about this because it talks about this program around vaccination with adults being a team sport. It's not just going to happen at the federal level. We need providers involved. We need community-based organizations involved. We need to get the message out and the right information out. For example, we had data shared today at the ACIP presentation that showed that there's still
mention what ACIP means.
Sure thing. The Advisory Committee on Immunization Practices.
And excuse me, Dr. Patel, the reason why I wanted to mention that only is because these regulatory bodies that are overseeing the quality and safety and effectiveness of these vaccines have also on them people of color. Scientists of color are on those committees. And I think it's important that we understand that we have our representatives in the back rooms when these decisions are being made. Excuse me for interrupting you, but you opened that door and I wanted to walk through that.
It's such an important point. You need to have representation on all of these groups. And so it's a team sport when the regulations are made, when the recommendations are made, when implementation is done. And so I'm just really excited to hear that there's movement in this needle, but we have a ways to go. There are still substantial disparities when it comes to vaccinating with our brown and Black populations. So still a lot more work to do, but I'm glad it's heading in the right way.
Well, Dr. Gigi, you know very well some of this work. You are very involved in community-based and faith-based organizations. What do you see as their role here in trying to enhance our compliance with evidence-based guidance on adult vaccines?
Before I say that, I just want to give a shout out to you, Dr. Tuckson, because as the founder of the Black Coalition Against COVID, and please visit the blackcoalitionagainstcovid.org, you came up with a holistic model that really engaged everybody, whether it be faith-based, whether it be people from the Greek life, the 4 historically Black medical schools, education, labor. That's important. I think that, we sometimes forget, especially as physicians, who we like to be in charge, right? That the community should be in charge. The leaders should be in charge. They're the ones that are driving this bus. We are here to serve. We are here to leverage whatever experience that we have. The most powerful kinds of vaccination, not attempts, but programs where we had one where the pastors got vaccinated on the pulpit, where we had people educating other people who worked in the community from community-based organizations to get people signed up. So it's not an afterthought, it's the beginning of how we should be doing things. We ask and we look at the priorities of the community, and we are there to serve. And it's those trusted messengers that are really key, but really having a partnership that's respectful, that respects the dignity and autonomy, and not just kind of lecturing people. So that if somebody says, I don't want a vaccine right now, okay, tell me why. Not like you need to, and then I'm going to move on if you decide not. So
let me just talk to the audience just straight up for one second here, based on what you said. I would imagine that almost every person listening to us on this show is involved in some community or faith-based organization. They are church people. They're in a fraternity or sorority, a poker group, a bridge club, pinochle group, whatever it is that you may do. But if Black lives matter, and I think they do, then they have to matter to us first. So please, let's make sure that we as a community, as Dr. Gigi has sort of indicated here, let's make sure that we as a community come together and save our own lives. We've got to realize that the weight is on us most of the time. And so let us just take care of ourselves. We've proven through COVID that we can and will do that. Let's do this for all the things that are facing us, and in particular, these adult vaccines. Well, now let me turn to our representatives from the pharmaceutical industry. And I want to start with you, Dr. John. Help us to understand what actions the pharmaceutical companies are taking to ensure that the public knows about the safety of vaccines and feels comfortable about that safety profile.
Yes, absolutely. Good evening, and thank you for the question. Just first, so happy to be here. I'm proud to be considered an immunization champion amongst this esteemed panel here. I think we're doing great work, and vaccines are just the best deal we got. So Let's go out there and make sure everyone understands the importance of them, the value of them, and then go get them. But I think, Dr. Gigi indicated earlier, she kind of listed off a list of providers that are involved in immunizations, and pharmacists are sort of the newest member of that group. I vividly remember my first year providing immunizations. It's been a little bit since I practiced, but it was 2008, and I conducted an offsite clinic at my pharmacy, and I administered 12 flu shots that day. The entire day, 12 flu shots. The very next year, our one store did nearly 30,000 flu shots, and now it's in the tens of millions. And in fact, 3 out of 4 COVID vaccines are done at a pharmacy. So it's incredible how that has evolved. And I think that shows how much trusted and resourced that pharmacists are in the community. And I think that that's the most important word here, is that community pharmacists. We are embedded in the community. A lot of times we live there. We look and feel like the people that are in the community. So people do trust us. We're the second most trusted profession. So I always welcome, and I know my pharmacist colleagues always welcome folks to come in and ask questions about their health. Ask about vaccines. We talked so many things about vaccines today, so many of them, so many doses, who needs what, when you need it, those types of things. Come in and ask those questions. And I think the other biggest factor that helps us succeed in this is that those community pharmacists partner with those community-based leaders that you talked about, whether those are community-based organizations, faith-based leaders, those who address social needs. Together, we are this powerful team that really understands the sort of local and social and cultural dynamics of the community, so that we can bring out the right message and help them understand why this is a good option for you. And I think in having that sort of two-way conversation, we're able to get people a lot more trustful of what is in front of them. And not only that, but get them excited and activated that this is a healthcare service that can help save their lives and help save their families' lives. So I think that's it's a wonderful aspect that pharmacists now are playing a major role in vaccinations, and it's similar to a lot of other health services. And it's just great that as providers, we can work together as the immunization neighborhood and really bring the message out to the community.
That's an important point. I'm going to come back to that in a minute and follow up a little deeper into that. But it is not lost on us that you are a man of color, a leader. I mean, this is by the way, congratulations. This is an incredible job that you have, Director of Healthcare Strategy for one of America's largest and most important companies. How do you think about these issues of how you can do helping the Black community to be able to close these gaps in vaccination coverage?
Yeah, so thank you for that question. It's something that we had set out at the beginning when we rolled out our COVID vaccines, is to understand the needs out there. I think Dr. Gigi mentioned it first, is that you don't just go out there and say, I have this vaccine, you come and get it. No, it starts from having the conversation with the patient. Tell me what you know about this vaccine and would you be interested in getting it? Let me help talk to you a few things about the vaccine and help you understand a little bit more about it. And then to only make a recommendation. I think it's those important steps. And so we understood that it needed that approach for us to be successful in reaching communities that, as you mentioned before, that they might have been distrustful for this or that reason, or they might have actually had true access barriers. Perhaps they didn't live by a vaccination site, or they didn't have transportation. Just as an example, we were able to bridge that gap in transportation in that we partnered with Uber. And when folks were able to make an appointment, they could indicate that I don't have a way to get there. And we were able to set them up with an Uber ride so that they can make it to the pharmacy and have that appointment. I think that was one of the strategies we had. The other one was, again, our pharmacies, and it's a pretty wild stat, 90% of the US population lives within 5 miles of the pharmacy. But that doesn't just mean that everyone's going to automatically come in. So what do? We go out to them. We had a big, huge coach bus that we outfitted to be able to provide vaccines on. We drove around the country. We parked in a neighborhood. We knocked on a door and said, hey, I just want to talk to you about the COVID vaccine. And then at the end of that conversation, I was able to say, so would you like to just walk across the street and get it? And they so appreciated that we were right there. And that we addressed what we felt were the barriers, and that they confirmed were true, that I may not be able to get to the pharmacy, or I may not want this vaccine, or I may not be able to afford the vaccine. And we understood that those were going to exist. And so we decided that we would have the answers to those questions and eliminate those barriers. And I think it's a tremendous credit to Dr. Patel's agencies and all the work that they've done along with the other federal partners to ensure that together we could eliminate a lot of those barriers. And I do hope moving forward that we have seen this experience and these populations know that we can now do this every time, and trust these providers, trust your pharmacists, and we will be successful in other healthcare areas as well.
Thank you for that. As I turn to Dr. Ambrose, I would just sort of say to our audience, if you have young children, especially young girls, bring them to the screen right now so that they can see Dr. Carita Ambrose. It is very rare that we in our community get the opportunity to meet someone who has a doctorate in microbiology, special training in infectious diseases, but someone who has launched several vaccines that are currently being used in the marketplace today for diseases such as influenza and meningitis. I don't think sometimes we realize that we have these role models sitting right there in our community. And so every chance we get to be able to connect people to that, let's do that. So bring, I don't know about you. I watched Coco Gauff the other day over the weekend, and I just went crazy at how wonderful she performed. I look at our gymnasts and how wonderful she performs. But here we have scientists of color that we need to make sure that we are able to celebrate. But with that buildup, Dr. Ambrose, I didn't mean to embarrass you, but you're important to us. Help us to understand some of the latest developments in adult vaccines, including research and technology advancements. I really like the science of all of this, you see.
Sure. Well, thank you so much, Dr. Tuckson, for those very, very kind words. And I am slightly embarrassed. So I'm sure my face might be turning a little red here. But the technological advancements that we've seen with our vaccines, I think we are in a great space. We, along with other manufacturers, are continuously looking for ways to innovate in the vaccine space. And I think that's very evident by the newer vaccines that we have now for RSV, as well as improving technologies for vaccines that were existent. And that was like our shingles vaccine. We have a more effective shingles vaccine now in the market, as well as with Hep B. And taking that further, Dr. Patel mentioned earlier about flu vaccines and mentioned the vaccines for older adults. This is also another example where we have improved upon the technology that was there for an existing vaccine. We know that our current flu vaccines are safe and effective, but we know as you get older, your immune system starts to wane. It doesn't respond like it did when you were in your 30s, when you get 65, and probably even a little bit before that. And so there are 2 vaccines that were designed specifically to address the needs for older adults and for influenza. And both those vaccines are recommended and preferentially recommended by the Advisory Committee on Immunization Practices, the ACIP, for 65 and up. We're not alone in this pursuit. There are other companies that are also utilizing a number of different vaccine technologies to advance to better and more effective vaccines. And I think it really puts us in a good space. And instead of fearing it, I think we should embrace that. It is because of the Tuskegee incident that we have these measures in place to ensure that our vaccines are safe and that everyone is being treated fairly there. And I wanted to just come back and just speak a little bit to ensuring the public about the safety of vaccines. The safety of vaccines is always at the forefront. And as I said on the R&D side, that is what you start with. How safe is that vaccine? And that continues on through phase 1 studies, phase 2 studies, phase 3 studies, but it doesn't stop there. Companies, we're required to continuously monitor the safety of our vaccines. And that is beyond when it's out in the masses, and it can be 20 plus years in use now, we're still monitoring the safety of those vaccines. And this allows us to ensure that if there are any issues following immunization with those vaccines, that we are detecting it early and we can respond in a timely manner. And then additionally, the CDC monitors the safety of vaccines through several safety surveillance systems. So we are in a time and place where we are monitoring the safety of vaccines constantly and continuously from preclinical stage all the way through its lifespan.
Excellent. And I think one of the things that, again, having people like you in decision-making leadership positions inside of these companies puts the myth to this idea that somehow other people are doing things to us. There's some great conspiracy of harm that's being inflicted on us. And yet what we're learning more and more is that we are also inside of these places doing the work, trying to save our lives. I also want to make sure that we do not lose an essential point that you made about Tuskegee, which is something that most people, again, don't understand. The horror of Tuskegee, when it was a horror, it was a dastardly, horrible stain on the American soul. It led to changes, and it led to a whole new system of ethics and the way in which research is conducted in this country. And that's important to know, that those men who suffered and died prematurely did not suffer and die in vain. It led to a fundamental change in how research is done in this nation. And that becomes extremely important for us to remember. John, let me come back to you, Dr. John, and understand the point that you were getting into earlier about being able to go to a pharmacy to become vaccinated. How does this work? And what can people expect from their pharmacists when they come in to get vaccinated?
They can expect a wonderful experience. I'll start off there. No, it's funny, beyond dispensing medications, which is the thing that pharmacists are most recognized for. The second thing is providing immunizations, and we've been doing so for several decades now. Pharmacists are expertly trained, not only in the curriculum when they were back at pharmacy school, but additional training modules that happen at very frequent cadences to allow them to stay up to date on the latest recommendations and stay up to date on immunology and everything that is involved in the vaccine. So they are a very expert provider in terms of providing immunizations, and coupling that with being a very important messenger and an important communicator to be able to translate the information that may be more scientific, but allow a patient to help to understand it a lot better. And so I think that's a real key of why the pharmacy setting has proved to be successful for patients getting their vaccines. Like I said, I told you in the previous story, we've seen the evolution and growth and how many more times that patients can access vaccines at the pharmacy. And we've even seen the types and the different types of vaccines that pharmacists are able to administer over the years. When I first started, I really was only able to provide you a flu shot. But now the whole list of vaccines that Dr. Patel and Dr. Gigi had listed out there, those are all things now that for all intents and purposes can be accessed at the pharmacy.
Let me turn to Drs. Myers and Gigi as clinicians seeing patients regularly. How do you advise patients if they go to the pharmacy and get their vaccines, whether it's COVID or whatever? How do they connect that in to you as their, providing their medical home, as it were?
For a lot of patients, it actually is very simple because of electronic medical records. And I know as physicians in particular, we're not always, rah-rah about electronic medical records, but this is one thing where it does make things much easier. And if something happens in the pharmacy, a lot of times that information can actually be downloaded directly into that patient's chart, so that we can see that, this person went to Walgreens and got their vaccine on such and such date. If it doesn't show up automatically, it can be added into the system when they are checked in, because one of the questions that they are asked or should be asked by the person who's doing the check-in is what's happened since you were here last time? Have you been hospitalized? Have you had any vaccinations, any surgeries, any procedures? So we can keep their medical record up to date. So that can happen during the visit, and it should be a very seamless process.
I would say that it also depends on the system. So vets through the VA system actually have a great system which keeps track across the country. Kaiser is another model. We live in, quote, a tri-state area, even though DC is not a state, in Virginia and Maryland. So it becomes sometimes challenging to get that information. But I agree with Dr. Myers, sort of the electronic medical record can be very helpful. And as I think we are increasingly understanding as a healthcare system that is actually a really good way to track, but it doesn't hurt for us to keep track ourselves. Because I think that's really important.
So you're saying that Dr. Myers shouldn't let me off the hook here, that while the electronic records may do that, I'm supposed to keep track of this myself. Is that right?
It's always best for you to be in charge of yourself. You know what I mean? Because, I always tell people, even if I had a 95% accuracy, which I pray I do, there would still be a 5% miss rate. And who is better invested in their care than the individual or the individual's family?
Well, that's a great point. And by the way, folks, not just for vaccines, but you should be keeping track of all of your medical record. And there are multiple tools that will do that. Thankfully, as we have heard, there are the electronic medical records that also keep track for you, and you're able to plug in online in so many places and be able to follow your own complete medical record. There are some places that don't have that. And so if they don't, make sure that you keep a record of your whole health history and all the things that you are doing. And if it's being provided online, make sure you're reading it. Go online and look at it. I mean, we look at our bank statements all the time, but without health, what's the point? If we're not around to be able to have a bank account, let's make sure we take care of ourselves as the number one priority. Be as serious about that as we are with our money, and I think we'll be much the better for it. Let me turn to some general questions from people in our audience whom we know have kind of questions that are important. And earlier on, we talked about the importance of the flu vaccine during this time of the year, and the pneumonia vaccine at this time of year, especially for adults. And now we have the new COVID vaccine for sure. Let me tell you, Dr. Patel, are we safe in being able to get all three of those at the same time? Do we need to stagger them out? Can they all go in one arm? Do I need to put one in one arm, one in the other, one in the leg? I mean, how does this work?
It's such a good question. We're getting that question a lot at CDC. So the first thing is knowing which vaccines you actually need. And not everyone needs all three. For example, if you're less than 60, you don't need the RSV vaccine. And then the second thing, it is completely acceptable to get all of those vaccines together if you want. It's also acceptable to split them out if you want. And so really it's a conversation that you have with your provider that both of those options are okay. And then to your second question about where, yes, we want to separate where those vaccines are going. And there's good information on cdc.gov exactly how you should administer multiple vaccines at the same time, not just these three vaccines.
Great. Dr. Myers, there may be some people who are a little bit skittish because they think that they may have some secondary effects of being vaccinated, at least in the short term. Is that a significant concern in your mind?
I think anyone having an issue is a concern. The question is whether it's really a life-threatening issue and whether it should impede your ability to get vaccinated. There are some things that are short-term and very easily treated. If you have a sore arm or if you have a little bit of a headache, getting a lot of feedback, sorry. If you have a sore arm or a headache after the vaccine, that is not something that should preclude you from getting vaccines again in the future or should impede your ability to get the vaccine at that time. A lot of times they recommend that you take a Tylenol after the vaccine, and that tends to make those things easier. If you have a more serious reaction to a vaccine, like a Guillain-Barré or something like that, where you have a more life-threatening issue related to a vaccine, then that may be a different conversation to have with your doctor about which vaccines may put you at risk again for another reaction. So understanding which reactions are life-threatening and which reactions really may impact your ability to be vaccinated again is an important issue. If you have a headache or a sore arm after a vaccine, that's not something that I would quantify as something that would preclude me from recommending vaccines for you in the future. If you have something that's more serious, then that may be a different conversation.
And certainly, for sure, the minor discomfort for a moment of the vaccine is much less than the disease itself. That's for sure. We're there. Dr. Ambrose, you talked earlier about technology, and we have new ways of being able to make vaccines. But one of the elements of that new technology is something that many people are not familiar with, comfortable with, and that's genetics. We heard with the COVID vaccine that it was an mRNA vaccine. And that really made a lot of people anxious. How do you view the new era of genetic medicine, and should we be afraid of it?
Absolutely not. We should not be afraid of technology. This is what we've worked for. This is what we have, those that have gone before us, the scientists. This is the time when we should be doing this. And what I tried to do, as people would ask, there were so many myths about the mRNA vaccine, is to really tell that we were able to get a vaccine that saved lives in about a year's time. That's progress. That's great. And I think one of the key things that we have to do as we talk about technology and embrace the technology is to educate it. Starting with our healthcare providers, making sure our HCPs understand, they know the technology, and then making sure the people, the consumers know, making sure that Blacks know that this is not targeted against you. This is for you. This is to help you. And I think we have to do that so that we can get away from some of the myths and the fear of the technology. And I think sometimes, if it's maybe some of those more devastating diseases such as cancer, I don't know that we question it. We embrace that drug. I think we have to be the same way about vaccines because they're saving our lives. The viruses are getting smarter. They're, we see COVID, new variants coming out. They're doing their thing and they're constantly mutating. And we have to be utilizing the technology we have to be able to address that so that we can save lives on our end.
And one of the audience members is curious, and I'll just answer it real quickly because we're going to go through a bunch of these really fast, reminds us all that genetic vaccines do not get into the DNA and they do not change your DNA. That is a myth that we want to stamp out. Is that right, Dr. Ambrose?
That is correct. They do not integrate into our DNA at all.
Another one question from the audience involves the trends in immunization since and during COVID. And as I mentioned earlier, the one trend that I want you to remember, audience, is that from a very slow start, we ran a race and beat the rest of the nation, or at least tied them. And our results in terms of our life expectancy showed the results from that. I think that what we also, though, are worried, and are we seeing, does anybody on the panel kind of know now, are we falling more behind in our usual adult vaccine compliance since COVID? Do we have some ground to make up? Who wants to take that?
I can take that. Yeah, we do have some ground to make up on our adult vaccines after COVID. So we did see, following the COVID pandemic, adult vaccination rates, our routine adult vaccination rates decrease. And there was actually a report that globally, there were 100 million doses of adult vaccines missed. So we do have some ground to make up. Now, we have seen some of those levels, some data show some of those levels kind of starting to come back to pre-pandemic levels in terms of what's being administered now, but we have some ground to make up in that respect. So it's very important that people talk to their doctors, nurses, pharmacists about vaccination. And I think another thing that is helpful as we enter this time of year, with the fall, people will be going to their providers to talk about the seasonal vaccines, the flu vaccines. People will be going to talk about COVID vaccines, et cetera. But also remember that throughout the year, adults can also get other vaccines. The shingles vaccine can be administered throughout the year, hepatitis vaccine, pneumococcal vaccines, et cetera. And so while this is the time where people go to talk about other vaccines, remember to use throughout the calendar year to talk to your doctor, talk to your nurse, talk to your pharmacist about what other vaccines. We encourage people to talk about what else they might need.
And by the way, for the parents in the audience who are bringing their little kids to the screen, I think Dr. Candace Robinson is an excellent role model for all of us. And I remind you, audience, that Dr. Robinson, in addition to being a board-certified pediatrician, is the Director of Scientific Affairs and Public Health Vaccines for U.S. Medical Affairs at one of America's largest and most important companies. And so, again, these faces are not put here by accident. We really want to make sure that people understand. By the way, Dr. Robinson, one of our questioners is interested, still worried that a friend of hers got multiple vaccines and there were complications at one time. Do you want to double down on Dr. Patel's comment, or what guidance would you give around taking multiple vaccines at one time?
So I would say, talk to your doctor, talk to your pharmacist, talk to your provider about vaccines, what you need, and about, any side effects or anything that you've had following those vaccines. We really encourage people to talk to their providers about vaccination and about what they've experienced following vaccination for further guidance.
Everyone, we are 3 minutes away from close. I have 1 minute that I want, though, 10 seconds from each one of you, starting with Dr. John. 10 seconds. What's the one thing you want the audience to remember?
It's a policy thing. Vaccines are free for now, virtually every single American. As policymakers, we made that happen. So that is no longer a barrier. Come into Walgreens, talk to your pharmacist about vaccines, go online, be able to schedule multiple at a time. Just get vaccinated.
Dr. Myers.
Understanding that vaccines help not just prevent illness, but also may make an existing illness less serious, reduce your risk of having a serious outcome, being hospitalized or death, and also help prevent you from spreading to someone else.
Dr. Gigi.
I want to give a shout out to Grandparents Against COVID. It takes a village to educate us and to get everybody involved in getting vaccinated. And I don't want to forget the important role of seniors. Dr.
Patel.
Know what's in your toolkit for this fall respiratory season. And if there's a tool missing, like a vaccine, make sure you go and get it.
Dr. Ambrose.
Vaccine saves lives. While it's impossible to know what each season will be, particularly your flu season might bring, if you've seen one flu season, that's just it. You've seen one. It's important for us to be prepared. It's important for us to get vaccinated to protect against serious illness and hospitalization, especially those that are more vulnerable.
And Dr. Robinson.
All too often, adults miss the opportunity to be vaccinated, despite the fact that adults are at increased risk due to immune decline as they age, due to greater risk for comorbid conditions or chronic conditions. And so really encourage people to talk to their doctor, talk to their nurse, talk to their pharmacist about what vaccines they may need throughout the calendar year.
And that's all for tonight, audience. We hope that you not only benefited from it, but more important than benefiting from the information is acting on the information. Put it to good use for yourself and all the other adults in your family. And for the women that are watching this show, grab your husband or your significant other, because a lot of times it's the women who force men to do what they need to do. At least that's the way in most places. So it's up to you. Let's move it forward. Thanks so much to our panel. They are wonderful. Thanks for our sponsor, Bio. We appreciate your support for these efforts. And thanks to the team at blackdoctor.org. Once again, you all are terrific. Have a wonderful day, everyone else. Thank you all for tuning in. You're a great audience. Bye-bye.